Now starting with the arterial supply of the thyroid actually. Now we know actually there's superior thyroid artery actually, which is the branch of external carotid artery that enters into the upper pole of gland. Okay, then it divides into the anterior and posterior branches in anastomosis. Then it becomes ascending with the inferior thyroid artery, and since the upper pole is narrow, ligation is very easy there. Okay, the inferior thyroid artery, which is actually the branch of cervical trunk, actually it enters the posterior aspect of gland and divides into 4 and 5 branches. It enters the gland at various levels, not just truly the lower pole. Okay, inferior thyroid artery, which should be ligated well away from the gland in order to avoid the damage to the recurrent laryngeal nerve actually, and basically ligation of these both arteries will ultimately cause the permanent hypoparathyroidism. The current practice is to identify, basically ligate the branches of inferior thyroid artery 3 to 4 that was separately. Thyroid ema, which is the branch of either thyroid ema artery, which is the branch of either we have actually bronchocephalic trunk or direct branch of the arch of aorta. It enters the lower part of the isthmus in about 2 to 3% of cases. So basically you can see the blood supply of them, which we have actually discussed now. Actually you can see here that the superior thyroid artery is here, which is the branch of the external carotid artery. Okay, then we have studied about inferior thyroid artery, which is here, that is actually the branch of thoracocervical trunk. Okay, then you can see here the hyoid bone, and then thyroid cartilage is also present here. Then you can see here the recurrent laryngeal nerve. Okay, this recurrent laryngeal nerve actually enters from the lower side and lower pole, and then you can see here this that's where it should be ligated. That's what is important, to ligate properly the inferior thyroid artery from the gland, and also in order to prevent the damage to recurrent laryngeal nerve. Okay, we have actually the thyroid ema also here. Okay, so basically you can see here the thyroid ema artery here. Now moving towards the venous drainage, actually superior thyroid vein actually drains the upper pole and enters the internal jugular vein. The vein actually follows the path of the artery. Okay, then we have middle thyroid vein, which is single short and wide and drain into the internal jugular vein. Then inferior thyroid vein, which form a flexus and drain into the innominate veins, and they do not accompany the artery. Culture veins, which is rarely found between the middle and inferior thyroid veins. Okay, so basically you can see here the superior thyroid vein, actually middle thyroid vein, and vein of Kucher's. This actually is here, and this is the internal jugular vein. You can see here actually the inferior thyroid vein, also left bronchocephalic vein here, and they all are basically draining into the thyroid. They supply to the thyroid. Okay, then basically we say that the Kucher veins lies between the middle and inferior thyroid veins. Okay.